Hi, I'm Dr. Hirsch. Today we're talking about how to get started with hormone replacement therapy. Perhaps you saw the recent article in the New York Times inspiring you to be proactive about your health as you go through the perimenopause to menopause transition and you are interested in HRT. In this video, I'm going to tell you in 3 steps how to get started. First, we're going to cover the indications for hormone therapy. Second, we're going to talk about the contraindications to hormone therapy, who cannot take it. And lastly, we're going to talk about how to put this all together. If you don't know me, I'm Dr. Heather Hirsch. I founded a menopause clinic at Ohio State and also the Brigham and Women's Hospital and faculty at Harvard Medical School. And I now head up Midi Health, which is the first and best virtual platform for midlife women's health. If you're interested in an appointment, check the links below. We are open in 10 states, soon to be 50. I love taking care of women in midlife and specifically talking about hormone replacement therapy because I believe that all women deserve to get counseling to decide what is best for them. Now, the biggest fears most women have is about breast cancer, and I debunked that in a video I did here talking about the real risks of breast cancer from hormone therapy. The truth is that when we use bioidentical FDA-approved hormone therapy options, there really is not a statistically significant increased risk in breast cancer, yet there is many improvements to your overall health when taking hormone therapy, such as reduction in cardiovascular disease and bone loss. And it's important to know cardiovascular disease is the leading cause of death in women by and far. First, I want to talk about the indications for hormone therapy. Now, hormone therapy has many different terms. It's also called HRT, hormone replacement therapy, commonly in social media and in lingo. That really actually means physiologically replacing your levels for women who have premature menopause, menopause before age 40, or early menopause between the ages of 40 and 45. MHT, or menopausal hormone therapy, is typically what's used when you are going through menopause. Around the average age of menopause in the United States, it's 51 and a half, inching up to 52, but the bell curve is anywhere from 46 up to 56. The indications for hormone therapy are as follows. Number 1, severe vasomotor symptoms. Vasomotor symptoms is a fancy word for hot flashes. Number 2, night sweats. That's a fancy word for hot flashes at night, but it's the tossing and the turning and the heat intolerance that's keeping you from getting good sleep. The third is severe genitourinary syndrome of menopause. Now, I've covered genitourinary syndrome of menopause many times on my channel, and I will not stop talking about it because it is so important. I did a great video here all about how you can treat genitourinary syndrome of menopause with local vaginal estrogen, but it is also an indication for systemic hormone therapy. The fourth indication for systemic hormone therapy is osteopenia. Osteopenia is the beginning of bone loss. It is defined as a T-score done on a bone density test, a T-score of -1.1 to -2.4. That is an indication for hormone replacement therapy. Now, once a woman does have osteoporosis, hormone therapy has not been proven to get you out of osteoporosis. However, it has been proven to prevent further bone loss if you do have the diagnosis of osteopenia. Now, you probably want to know, Dr. Hirsch, this all sounds really good, but what are the reasons I can't take hormone therapy? There's many myths about why you can't take hormone therapy. And when I teach my students at Midi, we talk about red lights and yellow lights. Red lights means it's a hard stop where you cannot take hormone therapy. Yellow lights actually mean there's a little bit of pause and we want to investigate your current health history and your past medical history, but many things are yellow lights, which means I bet you've been told you can't take hormone therapy for a reason that is a yellow light. Now, I do have a course, and in my course, I go through all of this in detail. It is hours long and is a little too much for a YouTube video, but if you're interested in getting direct help with me and trying to figure out what's the right hormone therapy for you, and we do live courses, check out my course in the link below. Without further ado, let's talk about what the red lights are, which means that you're not a good candidate for hormone therapy because if you do have a red light, that means the risks might outweigh the benefits. Now, the first and most obvious red light is active breast cancer, and many breast cancer survivors are also not recommended to start on hormone therapy, and that's because the risk of recurrence of breast cancer is high. Now, it's not to say that there aren't some breast cancer survivors that fall into the yellow light group, but active breast cancer or advanced breast cancer is a red light. Another red light is a history of a clot in your leg, a deep vein thrombosis or DVT, or a clot in your lungs, a pulmonary embolism. Now, there actually are some kinds of clots that fall into the yellow light category. And that is if you had a clot after a traumatic incident. For example, a car accident. Now, because that traumatic incident was so intense, that's likely the impetus for the clot, not that you have a genetic predisposition to clotting. Now, an unprovoked deep venous thrombosis or an unprovoked pulmonary embolisms also fall in the red light category. Another red light category is any undiagnosed abnormal uterine and vaginal bleeding. Those must be worked up before you start on hormone therapy. Active liver disease, and liver disease, particularly end-stage liver disease such as cirrhosis. Things like fatty liver, these fall in the yellow light category and they are not the same. And lastly, something like a prior history of heart attack might typically fall in the red light category, but even some types of heart attacks, if you had a NSTEMI where you didn't have a clot necessarily, maybe you had what felt like a heart attack because of vasoconstriction, but the doctors could not determine that that was exactly the physiology, those can fall into the yellow light category. All that is to say, it's really important that if you don't have a really obvious red light, you might fall into the yellow light category, in which case having a discussion and an appointment with a knowledgeable physician who can help individualize your risk and benefit plan for you is something that you should really consider. NAMS, the North American Menopause Society, stands behind its position statement that if you have no known contraindication to estrogen, i.e. one of those red lights, that the benefits are going to outweigh the risks, particularly for women who have one of those 4 big symptoms and who are within 10 years from their last menstrual period. Now, even if you are 10 years from your last period or you don't know when your last menstrual period was, this is still a yellow light category and you're gonna wanna talk to a knowledgeable expert in menopause and midlife care. I know there's not many of them. The North American Menopause website has some docs listed there. And also at MIDI, we have top-notch, excellent doctors who can help you with this. Once you've decided that you're interested in hormone therapy, you have an indication for it, you don't have any red lights, now you're on the path to thinking about what is the right option for you. And there's many different kinds out there, and there's so many people telling you you should do this or that or this or that. I am here to lay the line down and tell you that the best form of hormone therapy is FDA approved, commercially available, bioidentical hormone therapy. Now, let me say that one more time. FDA approved hormone therapy is the absolute gold standard and the evidence-based model. Things like this compounded creams of estrogen, testosterone, progesterone are not FDA approved, and other things like pellets are not FDA approved and they are highly unregulated and dangerous. So you do want to be sure that you're on FDA approved hormone therapy. Now, there is FDA approved bioidentical hormone therapy, and bioidentical simply means that the main ingredient or the formulation of that hormone therapy is estradiol, and that the progesterone is micronized natural progesterone, also known as prometrium. So you do want to start with things that fall in that category. But the FDA approval, I know many people will say on my other videos, I don't trust the FDA. What it means to me is that it has been studied in long-term studies to be safe, to be efficacious. And when I say things like I do not feel as though it increases the risk of breast cancer above statistical significance, when I say that the benefits outweigh the risks, that is all based on the long-term studies of FDA approved hormone therapy regimens. That is the gold standard. Once you've decided what those are, then you and your clinician think about the route. Route to mean, are you going to take it oral or transdermal? Now, transdermal estrogen is very popular. I still prescribe oral to many a patient, but transdermal does lower the risk of blood clots even further and nearly mitigates the risk of blood clots. If you are a woman for whom fall into that yellow light category, it is likely that transdermal estrogens, because they avoid first pass metabolism in the liver, are going to be offered to you first line. But also oral estradiol can be really good for mood, hair, skin, and works really quickly and also very efficacious. So it's not that one size fits all. So first you figure out the formulation, which we talked about, FDA approved, and you could use FDA approved bioidenticals, then the route, oral versus transdermal, and then the dose. And the dose depends on the severity of your symptoms, the depth and the breadth of your symptoms. You know, are they daytime? Are they nighttime? So much of this is individualized, and it's really great if you have a great doctor who can help you with this. If you don't, then definitely again consider my course, because I go through this step by step with you and do live sessions to help you and get exactly what you need with your doctor. I hope this video was really helpful. I think that all women should have full knowledge about what hormone therapy is, how it works, why it's efficacious. Not only that, but don't forget there are many other benefits of hormone therapy, such as heart protection. So watch this video here if you are not totally sold on the benefits of hormone therapy. Now, one size does not fit all. If you are not a candidate for hormone therapy, definitely check out my video next week where I'm going to talk about the medications that can be used if you're not a candidate for hormone therapy. Thank you guys so much for watching my channel. So many of you watch my videos and are not yet subscribed. I definitely want to encourage you to subscribe, because that's going to tell the YouTube algorithm that this is the best place for evidence-based information on all things midlife and menopause. Let me know down in the comments what was helpful, what questions still remain, and I'll see you guys next week for a brand new video. Bye everyone.